enrollment possibilities, the benefits, and then some of the areas that are not covered by Medicare that most people call the gaps in coverage. So as far as the definition is concerned, Medicare is health insurance, and it's for people who are 65 or older and U.S. citizens or residents who've lived for 5 consecutive years in the U.S. Or you could be any age and have been receiving Social Security disability income for 24 months. People can be any age and disabled, and after they've received their disability allotment for 24 months, then at the 25th month point, they're on Medicare. So you can be any age and have end-stage renal disease, which is kidney disease, had a kidney transplant, or have ALS, which is known as Lou Gehrig's disease. And it is for people of all income levels. It is a federal program administered by the Centers for Medicare and Medicaid Services, CMS. That's what you'll see on the letterhead of things you get in the mail or on the envelope. It'll say CMS. There are 3 Medicare health plans. Original, as I said, that's my part. That's what I'm going to talk about today. Then Medicare Advantage plans, which Sarah Jane will do, and she will also talk about prescription drug coverage. Now, Medicare Advantage plans are sometimes called Part C, but in case you see that and you're confused, a lot of things have 2 names, unfortunately. But Medicare Advantage plans are actually a way of getting your Medicare benefits through private companies, but you're still attached to Medicare. They have to approve those companies. So there's a couple of different ways to join. Automatic enrollment in Medicare happens if you are receiving Social Security benefits when you turn 65. You are automatically then enrolled in Medicare Part A and B, and you will receive that information in the mail, the Medicare card, about 3 months prior to your 65th birthday. Now, when it comes in the mail, it's a bigger card like this, and then your little Medicare card is attached to it. And it will say, you don't have to do anything. You're going to have A and B starting, it will tell you that starting the first day of the month of your birthday. Actually, it starts a month before if your birthday's on the 1st, but that's an exception. So you will get this card in the mail, and it will say you don't have to do anything if you want both parts, A and B. A is the hospital, B is the medical outpatient. And most people don't do anything, then they have their Medicare card, which they can use on the first day of the month in which they turn 65. There is an option to decline Part B that's mentioned on that card, and if you want to not take Part B, then you have to return the card. And we'll talk a little bit more later about what Part B does for you in May and why you might want to hold off on that. Some of the people who are still working and have coverage for the Part B services can hold off. But then they have to be very careful that they join within a certain length of time later, or they could have a penalty. So again, as far as automatic is concerned, if you're getting Social Security disability for the 24 months, like we said, then you're enrolled automatically in Part A and B beginning in the 25th month of your disability. Applies to any age. There's a lot of people that are very young that are on disability. What is not automatic enrollment is if you're turning 65 and you're not receiving your Social Security benefit yet, then you have to apply for Medicare. You're not in their system. So the initial enrollment period, and you have to initiate this yourself. You can do it online nowadays. You can go to Social Security Administration Office, Binghamton, Elmira.
They used to have one again, do they still have one?
I don't know.
Yeah.
There's 7 months that you can use this enrollment, initial enrollment period. The 3 months before your period, your period, I'm talking about enrollment period. 3 months before is a birthday in which you turn 65, the month that you turn 65, and 3 months after. That is called your initial enrollment period. We have lots of acronyms in Medicare, like everything else. So IEP, you might see someplace. That's your initial enrollment period, the very first time that you're joining. If you miss this, you may enroll during the next general enrollment period, which is January through March, but your benefits won't start until July if you do that. So it's very important to realize those dates and get that done. Okay. Now another enrollment period is annual coordinated election period. That's called AEP. This happens between October 15th and December 7th. And during this time, you can enroll, you can disenroll, you can switch plans. You can change from one to the other for your health care and for your Part D prescription drug plan. The last time you do that, make a change, so maybe you made one in October 15th or 17th, and then something came up, you changed your mind. You made an appointment or did it yourself and made another change in December 1st. Whichever one you do last, before that deadline of December 7th, is the one that's effective January 1st of the upcoming year. So that time of year is when you'll see a lot of ads on TV. A lot of people are scrambling, making whatever changes they want to. But the last one you do is the one that takes effect. Okay, just a minute on some definitions so we know what we're talking about. Premium is a periodic, usually monthly, payment to Medicare or an insurance company or a health care plan for your health or your drug coverage. That's premium. Monthly premiums usually are what is in place. A deductible is the amount you must pay out of pocket for your health care or your prescription drugs before any of these services take effect. So you have a deductible for original Medicare. We'll talk about what those are later. And a premium for a Medicare Advantage plan, perhaps, or a prescription drug plan, whatever that is. If there's a deductible on top of the premium, then you have to reach the deductible amount before the benefits kick in. Co-insurance is an amount you may be required to pay as your share of the cost for the services after you pay any deductibles. So it could be it's usually a percentage. So let's say whatever plan you have, and you'll see it in examples to come, is going to pay 75 cents or 75%, you're going to pay 25%. That's a co-insurance. The co-payment is an amount you may be required to pay as your share for a medical service or a supply. So let's say you went to the doctor's office and they charged you $50 and you have to pay 20 of that. So that's a co-payment. While it's easier to talk about your personal cases in an appointment, if there's something that's not making sense or you don't understand what I said, I can take questions. But it's the individual problems that you might have or concerns you might have. You can see one of us later or call Arlene for a special appointment because everybody's situation is so different. And people have retirement plans that are different. So if you don't get something here, you can ask. But the personal information or questions, I think, would be better later. So, original Medicare, available nationwide, has two parts as opposed to plans. These are parts. So we have Part A, which is the hospital insurance. Part B is the office visits to different doctors certain durable medical equipment, outpatient services. That's just a couple of examples, but Part A, and I'm interrupt myself here. You'll get this book in the mail when you are a member of Medicare. Usually comes in the fall, or we have some here. But most people just go, oh yeah, well that's kind of thick. Maybe I'll read that later. But it's pretty user friendly. It's big print. There's a lot of information in here. And when we get to preventive services that we're going to talk about, there's some explanations in here that will help you look at that program too. So don't be afraid of this book. It really is helpful. So Part A covers inpatient hospital care. Inpatient meaning you have formally been admitted into the hospital by a doctor, by a hospital doctor that has some credentials there. And we're making a bigger point of that these days because you may have read some things about observation period or observation status. This can happen when let's say you went into the ER and the doctor says, yeah, I'm not completely happy with what I see here. Maybe we'll keep you overnight, or for 2 days, could even be. And they're supposed to let you know within 24 hours what your status is, but it doesn't always happen. Things are in transition with this observation status. The reason it matters a lot is because if you're in observation status, it's not paid for the same way, and it's paid for as an outpatient. We'll talk about the costs on a slide coming up. But this is real important to know. Am I being admitted, or am I just being observed? Because it's going to matter in how it's paid for. But Part A covers inpatient hospitals. So also inpatient skilled nursing facility. Now, in order to be eligible for Part A to cover 20 days of your inpatient skilled nursing, you will have had to have spent 3 nights at the hospital inpatient. So there again, if you're going to be going to a skilled nursing facility for rehab or something, it's not going to be paid for unless you have spent those 3 nights in a hospital as an inpatient. Okay, Part A also covers home health care. You must be considered homebound and need skilled care. Your doctor must approve, and services must be received from a Medicare certified home health agency. I know you can read this yourselves. I just want to make sure I hit some of these points. Now, homebound can be kind of tricky because homebound, which you can read in the book, has very specific definitions. So homebound doesn't mean it's just maybe troublesome for you to get out or hard to get around. Sometimes there's very, very specific definitions to meet homebound. And you need skilled care. That's a definition in itself. So the doctor has to meet with you, approve this service, and then you must get it from a Medicare certified home health agency. The other part that's covered by Medicare Part A is hospice care, and I think most of you know you must be considered terminally ill, which can be kind of loose. Sometimes they aren't sure, of course, how long somebody's going to live, but there's certain guidelines for that too. So, continuing with Part A, the hospital part, premium for that, like a monthly payment of premium, there's no premium cost for Part A if you and your spouse have a 10-year work history in which you you paid into Social Security. A lot of places don't. We can kind of assume that, but like some states, the teachers don't pay into Social Security. They have their own retirement system, so they don't get premium-free Part A automatically. But in this state, it's different. So it's you or your spouse. Now you can still.
If you paid into what, Social Security?
if you have a job in which you had Social Security, deductions, you know, that to give you the benefits later. They take Social Security from your check, then, yeah. So if you have a 10-year, actually it's a 40 credits, and so, but that equals 10 years. If you've had a job in which they've taken Social Security out of it, and most everybody does. Yeah. So then, if you want Social Security and don't get it premium free, you can pay, but it's very expensive. When you go to the hospital, if you're admitted, we'll talk about the formally admitted, as soon as you go in as an admitted patient, the benefit period starts. There's a 60-day benefit period for which you pay $1,360. That's your deductible if you go in the hospital. Now, a benefit period starts, then it ends when you haven't used the hospital for 60 days in a row. It didn't sound right all of a sudden. 60 days in a row. So if you go in and you're released in 2 weeks, and you, for whatever reason, have to go back in another couple of weeks, then it hasn't been 60 days since you last used the hospital. So you wouldn't have to pay that $1,316 again. But if you were released from the hospital and you'd been out 65 days and then had to go in the hospital again, then you pay that again.
Does that include emergency room or just being admitted?
Being admitted. Now, for every day, this kind of gives us all the definitions: premium, hospital deductible, copay. If you're in the hospital longer than that 60 days, for which is paid your sum of $1,316, day 61 through 90, you will have to pay $320 each day. If you're in longer, $658 per day 91, $350. Now, people aren't in hospital very long these days, but there certainly are occasions when that can happen. Now, again, I'm just talking about original Medicare without anything else to help fill the blanks or to fill in what those gaps are. So we're just, if original Medicare is all you have, these are going to be your costs. Then skilled nursing, which we kind of call SNF units. There's a zero copay for the first 20 days if you've been in the hospital those 3 days and it's medically necessary. $164.50 per day for day 21 through 100 each benefit period. So these are things you really need to be aware of. I always remember this little story about my mother got out of the hospital, went into a skilled nursing facility because she needed that kind of care. And she had broken her ankle. She was already, 90, I think. She went in, she'd broken her ankle, and she had trouble making those, what they call transfers, you know, from the bed to the bathroom to the wheelchair, back to the bed. She had trouble making those transfers. And she didn't have a cast. Her ankle was, she didn't have a hard cast. She had a soft cast. And they kept telling her, you can only put 60% of your weight on your ankle. And she, finally one day she said, well, you're very nice and helpful, but I don't know what 60% is. Okay, well, we get to check the box that says can no longer participate in rehabilitation. They take her out of skilled nursing and put her in the regular nursing home. Meanwhile, my dad is panicked because he thinks he has 20 days of not paying this kind of money for her to be in the regular facility. So anyway, these definitions are very precise. with Medicare. Okay, Part B, the outpatient. So we have doctor visits, preventive care, durable medical equipment, wheelchairs, walkers, oxygen, home health care, x-rays, lab services, ambulance. The therapy meaning physical, occupational, speech and language. So those are all therapy services. They have a cap, but it's somewhere around $1,900 a year for those physical therapy. Okay. Now, back to those definitions. Part B, which is the outpatient part of Medicare, there's an annual deductible of $183 this year, 2017, which means that until you reach $183 out of pocket, the benefits of Part B won't kick in, which for the most part, we go down to co-insurance, the benefits of Medicare, Medicare will pay 80% of approved services, and the 20% co-insurance is our responsibility. The premium for new enrollees in Medicare this year is $134 a month. That is usually, in 99% of the cases, deducted from your Social Security check, which you can see when you get those statements. It'll say what your benefit is, and then it'll say what the Part B premium deduction is. It has really gone up in the last few years. 4 years ago, it was $104.90, and so now this year is $134 for new enrollees. Last year was 121 or something. So the Part B, we have Part A with the deductible for the hospital. Then we have Part B with premium $134 if you're new this year. If you're not new this year, then you're going to have whatever the premium was when you first were enrolled in Medicare. And then it might go up a little bit every year, the cost of living. You know, mine is $109 now instead of $104.90 because it went up last year. But, and so then once you pay your deductible of $183 out of pocket, then Medicare says, okay, now we'll pay for Medicare approved services, we'll pay 80% and you're responsible for the other 20. You will get statements every 3 months from Medicare, which we can note a little bit later. We'll tell you where you are in this as far as going along to meet your deductible. You can also go on if you're computer savvy. You can go online and do a mymedicare.gov and set up your own information site.
Are you saying once you hit your deductible, they pay 80% and you have to pay the other 20%?
Yes.
Anything or everything that is
all the Part B, yeah, all the Part B. And, you know, there's a more complete list, but just about anything you could think of that's outpatient. Yeah.
Well, it's supplemental insurance, so you get on your own. Oh, okay.
Okay, I'll get there. Okay, we're just talking about basic original Medicare all by itself with nothing else. That's what I'm reviewing here, is if you don't have anything else, any supplemental, anything. Now, and Sarah Jane will talk about the prescription drugs part, Part D, because original Medicare didn't have that. They want us to have it now, but it's not part of original Medicare per se. So remember I said, if you get your card in the mail, it will say you don't have to do anything unless you want to not have Part B right now. So there is a way to delay that. If you or your spouse do not have coverage through current, if you do have coverage through a current employment and you have health insurance benefits, or your spouse does, through that employment that are similar to Part B, then you don't have to take Part B. You can delay that if you have adequate medical coverage through your employer. And there won't be any penalty if you delay enrollment as long as you don't wait any longer than 8 months from losing that coverage. That can mean not of your choice or of your choice. I mean, it doesn't mean losing it because you got fired or something, but it just means that you don't have it any longer. And if you retire, you don't have that coverage through your employer anymore, then you need to start counting that time because you're going to need Part B, probably. You're certainly going to not want to have a penalty if you decide to get it later. I always say that we live in a free country, more or less, but if you don't have, nobody's going to make you take Part B, but if you don't have it, you're going to spend a lot of extra money, and if you want it 4 years down the road, then you're going to pay a penalty for the time you didn't have it, which stays with you for the most part. If you don't have active coverage from current employment, then if you don't take Part B right during the time you can enroll, like I said, you'd have higher premiums. And you might then end up waiting until the next general enrollment period, in which case your coverage wouldn't start until July. So it's one of those things where if you become 65 and you're unsure about which way to go, because you have to work with your personnel department and figure out, a lot of companies will do more, still do services for you after 65. Some companies won't. They say, you're 65, we're done. You have Medicare, so we're done. There's also situations where you're getting some good retirement benefits, but the company says, however, we're not going to pay them unless you have Part B, because we don't want to be the primary payer anymore. And after you have Medicare and you're retired, then Medicare's going to pay. So that's one of the things we do here. We don't just help you choose a plan. We can answer questions like that about how will my Medicare work with my company? How will it work with? Just switch this on. Thank you. How will it work together, Medicare and VA benefits even, or my insurance, my retirement insurance? We can talk about all of that. But if you're getting close to 65, you're still working, I think it's a good idea to talk with your benefits person about how it will work with Medicare. Are you still going to pay? And it also, it depends on the number of employees in your company, too, whether Medicare will pay primary, it's 20, or whether your company has to pay, and they're not going to be too happy about doing that. So just double check on what does your company have in the way of policies about turning 65.
Is that too high or is that good?
When you must have Part B, and we're going to talk about these. If you want to buy a Medigap, or it's called supplemental as well, or you want to join a Medicare Advantage plan, or you're eligible for the VA benefits, your employer coverage requires you to have it. So again, check with your union or your benefits. So just kind of a quickie how this works as far as payment. The provider, doctor, hospital, files a claim with Medicare. Now, if you need to make sure always that your providers accept Medicare. That's at the foundation of a lot of, they aren't going to just routinely bill Medicare. You have to make sure that they accept Medicare. I don't have, well, I haven't heard of any serious problems with that here in this area. Okay, then, so they file a claim, and if you've paid your deductible, then they will pay 80% of your claim if they approve it. If you haven't, then you'll have to keep going on your deductible, and your statements will reflect that.
In the background here, the $134 is coming out monthly from
Your social security check, or if you're in the category where you have to pay for your part, oh no, you're just talking Part B? Yep. Yeah. In fact, you know, they want people to make sure they're using their social security benefits before you get any special benefits, because that's a resource that we all have available. So nobody wants to pay for services unless you've used all that's possible. What is not covered? All the things we need when we're getting older. Routine physicals and tests. Routine, that's key. I know you can read it for yourself there.
And that's different than preventative.
Yes. Yes. Yes and no. Routine eye exam. The only time Medicare will pay for glasses is if you've had cataract surgery and you need a new pair of glasses after that. They won't pay for anything fancy, but they'll pay for a pair of glasses because your eyes have changed and you need new lenses. So, not any of this, as you can see, cosmetic surgery, unless, you know, if somebody had a terrible accident, you know, they would pay that. But we're just talking about cosmetic surgery that isn't essential. Services outside of the USA, that is something to keep in mind that I never thought of until I was in Germany and had an accident. Medicare does not pay out of the country. So, there are rare exceptions, which Sarah James could talk more about better than I. But you'd have to be on a cruise ship, certain miles out. Is another country the closest place? There are some exceptions, but generally speaking, if you've taken a month or two vacation to France or somewhere wonderful like that, Medicare is not going to pay. And if Medicare doesn't approve payment, then any secondary insurance you have doesn't want to.
What are they telling you? You can't do it.
You can, but you better have some extra insurance or not count on Medicare paying. You have to probably pay it yourself.
custodial having someone come in.
You know, where the custodial we're talking about is the nursing home, long-term care. A lot of people are under the impression that if you need nursing home care and you need to move into a nursing home to have all your needs met, that Medicare will pay, but they will not pay for custodial, meaning just basic living.
I think it's different state to state, because, you know, when you said that extra insurance we get to go with Medicare, my friend that lives in Groton, she had it like everybody else did around here, but when she moved to Georgia, she couldn't afford it, so she had to go to another company.
Yeah. Every state is different.
Yeah.
Every county can be different. Every county. New York has a lot of good benefits, more than most states, but even the counties are different in terms of, not radically, but in terms of the plans that they offer. So,
What is considered routine physical?
if you want to, let's say before I was on Medicare, I used to have an extensive physical every year with, you know, the urinalysis, the blood work, the whole thing. They won't pay for that. If you want it, they'll do it, but it won't be covered because they've substituted a lot of that with preventive care, which are that too.
Basically, annual physical, they won't take care of.
No, what you need, unless you're willing to pay for it, or you have another kind of supplemental insurance that will help with that. What they do now is this. And so welcome, I'm not gonna read through the whole list, you can do that, spare you. But welcome to Medicare prevention visit is what you can do within the first 12 months that you're on Medicare. But you need to make it clear to your doctor that what you're there for is a welcome to Medicare prevention visit. So they know to fill out the right kind of paperwork and not charge you. So they will screen, well, before I do that, so then after you've done your, when this became part of the law or the regulations, I was well past a year on Medicare. So I couldn't have that welcome to Medicare. But you can do an annual wellness visit, and then you can get that wellness visit every year. And then they review what they said the first time, and, you know, they'll do blood pressure. It's a lot of general things, and ask you lots of questions about how you get on, are you safe at home? I mean, because they want, it's prevention, preventing falls, preventing malnutrition, preventing a lot. So then they will screen you. Now, where you have a paper in your packets, I think. And I don't want to spend a lot of time on this, but I want you to understand that this is a long list of preventive services. Now, some of them don't require anything else. You just, like, for instance, the mammogram. We'll talk about the women here. The mammogram screening is free of charge. If they found some suspicious mass and wanted to do further screening, or not screening, but further, maybe a lumpectomy, or maybe they wanted to do further testing, that might not be free. It's the screenings that are free. Same thing with a colonoscopy. That screening's free, but if they found a polyp and wanted to remove it and test it, then you might have copays for those things.
And you go for your list of the women.
No, we're just talking mammogram.
Okay.
That's the screening. Then I want to mention something else. The depression screening, they will do that. And alcohol, misuse screening and counseling, those, see, we're moving towards much more of an integration of physical and mental health, behavioral health it's called. So if we talk about drug and alcohol abuse or misuse or depression, mental health issues, it's all being combined more with physical health now. So they screen, and if that comes up to be a problem, then the doctor's office can do short-term, I don't remember what you call it, treatment, but they could do some short-term counseling or make referrals, or send you where they thought could do a better job. But all these things will be looked at usually. Now, you take something like abdominal, that's why the expanded stuff is good to read, and the book has it too. If you look at abdominal aortic aneurysm screening, that's a very serious situation, and there are prerequisites before they even screen for it. So not everything here is simple or just happens with a snap, but they will take a look at almost everything on that list, and if you filled out a history and they thought that you had the prerequisites for that aortic screening, they would do that. So have to see anything that your history is going to point out to them, they will do. And some of it, then you can have follow-up in that doctor's office or be referred. I think I did this. This is You don't see any blood work there, or the urine screenings. So these are the preventive. And that's all it's meant to be. Just like Medicare was never meant to pay all our bills. Medicare is a foundation to give us health care, but it was never meant to pay everything. So,
If you go for the preventive visit at first of all, and you have questions on something else, will they'll bill you for the whatever else, but that'll still be, do you know what
I know,
I mean-
I don't know the answer, but I'm guessing that most places would tell you.
okay.
I mean, by the time they screen all that, pretty much gets everything. But yes, I think you could probably ask the question. The wellness visit is kind of a review of whatever they did the first time you were there. And they will look at all these factors, ask you, and it's, like I said, it's meant to be this basic foundation, but, there's a lot of people that, well, we come across there are a lot of people who just can't afford, don't have a primary care physician, don't have the specialist, and this is meant to kind of capture some of them, where they can, attend to these things for no cost. So this is kind of what I said before. If there's something that they come across, some things they'll still only do every 2 years, bone density, but those screenings are really important. I just had 2 screenings done and there's no charge.
Does the provider have any requirement to explain what's covered and what's not covered and the cost of what's not covered that you're gonna be billed for?
Actually, that's more our responsibility than theirs. That's why it's really, there's a lot of education done of physicians, but they just are often.
Could you demand that?
Demand that they tell
That they
you?
provide that before, so that you don't get a huge bill unknowingly?
That's why it's incumbent enough on you to say, this is my annual preventive screening.
Well, I'm also talking just Medicare in general, you go in
Well,
there
that's
because you're in
different.
an auto accident,
Well,
or
that's,
you're sick with hepatitis or something,
right.
and all,
But
what's covered, what's not covered,
Well, Medicare, except for this preventive category, are called screenings, not treatment. They're called screenings. Anything else that you might go to a doctor for is going to be covered under Part B of Medicare as long as you have it. And if you have other insurance, which we'll talk about, then they will contribute too. All right, I mentioned after a medical service, you'll get a medical summary notice that will say MSN right on the top. It will show the coverage of original Medicare. It may show a denial if they aren't covering it, and it'll tell you why, and then there's instructions for appealing this. It's usually sent every 3 months, and like I said, if you want to set up your own site, you can go to mymedicare.gov, and you can access your own personal information. So there you can see a little more detail there rather than waiting for a summary notice. And they'll even send you little dingers by email. Okay, it's time for that next yearly exam or next yearly test. I can't remember. Okay, I don't want to do that quite yet. So one of the other things I want to say is people get these summary notices in the mail, and it will say, this is the date we did this, or you went to the doctor, this is what we did. Medicare will pay this much. Sometimes it'll show that it's been sent on to another insurance that you have and what they paid or didn't pay. It will say, this is not a bill.
Yeah.
And so many people just go ahead and and pay that anyway. And they, you know, a lot of people get confused. They think it came from Medicare. My God, I have to do it. I have to take care of this.
Because it says, you may have to pay this amount, but yeah, it says this is not a bill. And I never got billed for anything, they said you may have to.
Right, so you may get billed means it hasn't gone all the way through the whole process yet. So you might get a bill, you might not, but this isn't it. This is not a bill. So, where you can tell somebody else maybe that is upset about that. But, okay, I'm just going to take a couple minutes before we take a break. I'm Sarah Jane. And here, all right, Medicare is not intended to cover 100% of the cost. We know that. All right. So one of the things that works with original Medicare, not instead of, but works with it, is a little bridge. Works with it is a Medicare supplement, capital S, insurance, also known as a Medigap. These policies are sold by private insurance companies, and they can help with what Medicare doesn't pay. They are standardized plans, which means that, now we're talking plan A or B or C or D instead of part A or B. We're talking plans for these Medigaps. There are plans A, B, C, D, E, F, G, half the alphabet. But standardized means that all plan A's will have the same benefits. All plan B's will have some more benefits, but they'll all be identical. Anything with a plan B is going to have the same benefits. All the way up, C, D, they'll all have their own list of benefits. But the difference can be what the company charges for them. So their Plan C is a popular one in this area because it covers just about everything that Medicare doesn't. It covers the other 20%. It will pay the hospital deductible. It will pay a lot of different things that a Plan C will. Now, you can buy Plan C from Progressive, United Healthcare, Excellus, and if you buy a Plan C, it will have exactly the same benefits as any other Plan C, but the company can charge a different amount. So, in our county, a Plan C, in our zip code, I should say, 137, 138, that plan right now that covers almost everything that Medicare doesn't, that plan will cost an individual $187 a month. There's no such thing as family plans with Medicare. Everything's individual with these kinds of
I thought
plans.
Plan F was supposed to.
It has one more benefit than Plan C that doesn't occur here very much.
Do they have a Plan F?
They do. They have all these plans. Basically what I'm trying to tell
So
you.
in other words, C is better than F now?
No. F has one more benefit, which is seldom used in this state.
What is that?
Excess charges.
Oh, because I'm on F, I'm already on
F's good. F's fine, and it costs the same right now.
I pay
SB.
185.
So 187, somebody new, and so my point is, if you buy it from one company, you're gonna pay 187. If you buy it from another company, you could pay over 300 for exactly the same benefits. So it depends on the company. Now, that's one of the things we help people decide here is which plan is better for me. We have lots of charts and we can have a lot of discussions about which of those supplemental plans provide what and how much they cost and how much they cost between companies. So we can help you with all that. So all the plans offer a core set, which is 3 pints of blood, and I get the other 2, but all of them do that. But then each one of those plans offers some other benefits. And just so you know that works with Medicare, can't have a Medigap and a Medicare Advantage plan, you can't have both. But Medigaps are the thing that work with original Medicare. So if you want to have some plan that helps you take care of something that Medicare doesn't, then we can help you with that. Or you can check it out yourself. Yes.
So will those, the Medigap, your supplemental, will that cover some of those costs that A and B don't cover? You know, like your,
Yes.
for your deductibles there?
Right.
Oh, good.
Yeah, so if, you said you have Plan F, so
But mine was AARP.
a Plan F will mean that it will take care of your hospital deductible, that $13.16. It will take care of charges if you're there longer. It will take care of your $183 deductible with Part B. It will take care of the 20% that you're responsible for after Medicare pays 80.
So you're pretty much covered.
You are
pretty much everything.
You're pretty much covered. It's, you know, $187 is not possible for a lot of people. So that's an expensive benefit for many.
Now, my husband has that, but I wasn't on it this year. We both have to take it, right?
Mm-hmm. Yep. So, anything else? We're going to take a quick break, and then Sarah Jane's going to talk about all the other possibilities that we have, like with Medicare Advantage plans, Part D for drugs, Epic, all kinds of other goodies.
Okay, we're back. Live. And, so this is Sarah Jane Blake, who I introduced at the beginning, and she will complete the rest of the presentation. I have a very small piece at the end, which I'll be thankful for. Thank you. And I am also one of the HICAP counselors here. Very fortunate to be working with all the counselors, and Arlene is our stateful director there. I also work for Statewide Senior Action Council, and our organization is a nonprofit. We work all over the state. So I get to talk with many counties to see how they are using Medicare plans and such in their area. Now, Kathy has talked about original Medicare, and I have what? Do I have like 50 minutes to talk to you about unoriginal Medicare, I guess, what I do. So I passed this out. Hopefully everybody has one, and it has a chart, and I love charts. So if you open it up, and there is this chart, and for the listening audience, it's called the QuickBooks at Medicare. So Kathy has been talking about original Medicare, which is on the left side of the chart. I'll be sticking with Medicare Advantage plans on the right side and Part D as well. Do you want me to go through the rest of Medicare? You didn't go through all of it? I didn't. No. It's about 3 or 4 slides.
Go through, you can go ahead.
Yeah, okay. Talking a little bit more about the Medigap plans under original Medicare, then we'll lap over into the other unoriginal things. Original Medicare, you can have the supplement plan, as Kathy said, to pay after Medicare pays. For example, you go into a doctor's office and you have Medicare, you give your red, white, and blue card. They say, you owe us 20% of the cost. And you say, no, I have Medigap. So you give your Medigap plan. One of the benefits is that it would pay the 20% for you. So it's like a primary and a secondary payer when you go in. And that is using still original Medicare only, and the Medigap only goes with original Medicare. You do have to look at the plans that you want to consider. First of all, can I afford it? If you can't, you move on to something else. The costs, as Kathy said, they vary. Even though the benefits are the same, the cost
of the premium is what is different. I can't get beyond the fact that if you can pay $187 for something that could be $300, but it's the exact same thing, why would you pay more? But that's just me.
Who's the insurance company that has it for $187?
I believe that's United Healthcare. And it's usually, it seems to be, I'll just speak from all the counties, it's usually the lowest cost one in New York State, United Healthcare. It's not the best one. You know, I can say yes or no on a couple of things that it covers, but it's your situation, which plan is going to work best for you. Medicare and a Medigap, you boil it down, you want a Medigap, and you look at all the choices in different companies that offer them. There are some places where someone will pay the $300 because my grandmother always had this company. I don't care whether it's more for Sterling than it is for United Healthcare. I'm going with the Sterling. It could be a lot more expensive. It's the way you look at it. What do you want to do for the Medigap plan?
I got a question for you. Is Blue Cross and Blue Shield in that?
Do they offer
Yeah, for.
a Medigap plan?
Yes, they do.
Yes.
Because when I got signed up, I always had Blue Cross and Blue Shield, and they said, oh, they don't cover it, that's why I had to go with the other.
Yeah. It varies. You know, some counties have that particular company, other counties don't. So you do have to do the research to see
That's why
which plan covers it.
I'm with United Health now. Yeah.
Now, when you want to consider a Medicare supplement plan, you can do so anytime during the year. That's in New York State. If you go to another state, different things apply. But in New York State, we're really rather fortunate because we can enroll in a Medigap plan anytime during the year. There is a limitation. I want to just give you some information on pre-existing condition. Some of the Medigap policies may have a, what do I want to call it, a gap between the time you choose it and the time it becomes effective. And that would be something like a pre-existing condition, but you can avoid some of that gap if you already have some sort of current insurance. You avoid the gap because it's continuous. If you have a 63 days without any sort of continuous coverage, or another time, however long it is, you may have to contend with the pre-existing condition gap. It is, with the pre-existing conditions, many of the plans don't have a pre-existing time frame, like 3 months before that Medigap plan or Medicare supplement would become usable. Throughout the state, I'm talking about. So, and some have 6 months before you can actually start using your Medigap plan. As always, there are exceptions. So some plans, particularly Medicare Advantage plans, that maybe don't even have a pre-existing condition. I'm throwing a lot of words at you, but there is something with a Medigap plan where if you purchase it, you may not be able to start right away. You'll have to contend with some of the issues that the Medigap plan have.
Is that just for that 1 year or for every year? Is that after?
No, when you first buy it, because I'm assuming you would just stay with the Medigap, you could, and it would just go on from year to year to year. Costs would go up. Again, lots of ways to look at Medigap plans. High tech, just come on in and talk to us. And we have, as Patty said, a lot of charts. We like to use charts, like I have too. You can call Medicare. You can call the plan directly. You can do the research online, Medicare.gov. That is the Medicare official government site, Medicare.gov. And it's got all the information we're talking about today, plus a lot more right there. Yeah, here comes my phone. Yes. I am going to talk about Medicare Advantage plans, also known as Part C. I know you mentioned that already, Kathy. Part D is the Medicare prescription drug piece. EPIC is a New York State drug plan. You've got the federal Part D. You can have New York State plans. Enrollment periods, when you can take advantage of all these wonderful plans and programs. And then if you don't do it in the right timing, you get a penalty. But nobody here is going to end up with one of those because the timing is going to be perfect, right? Okay. Medicare Advantage plans, it's still Medicare. Let me repeat that. You've got a Medicare Advantage plan, like on my chart. You've got original Medicare. Those are the two ways, your two options to get Medicare. So Medicare Advantage plans, still Medicare. Original Medicare is administered by the federal government directly, and with the Medicare Advantage plans, you've got that private company in there paying for your benefits. Did I mention Medicare Advantage plans are still Medicare? I just want to get that across because it's very important. Some people will say, I don't have Medicare, I have a Medicare Advantage plan. No. Two ways to get Medicare: original Medicare Advantage plan.
Can you give an example of a private company that would have it?
Sure. Humana. I just picked one out. Humana, and let me go with that for a minute. Humana they can offer Medicare Advantage plan under one umbrella. They've got your Medigap plans under another. They've got your Part D plan. So each company can give you any of the pieces.
Is that supposed to be good?
Options are always
Because
good.
I know people that retired from IBM switched to that.
That's a little different issue when you have another company involved. So this is more or less straight on the market Medicare plan. When you're looking at another company or your employer, it's a group Medicare plan, a little bit different. So right now we're on the market with straight Medicare plans and Medigaps and Part Ds and such.
So Medicare Advantage, they choose who the private companies are? They choose them?
The Medicare Advantage plans are offered by certain companies, and you choose the company. Yeah. Yep.
But if you do that, then you can't go back to the original
Sure you
Medicare,
can.
right?
There are many options. You can go back and forth. So, and we're going to get into a little bit of that with the enrollment periods. When can I make changes? If you just enroll in Medicare Advantage plan first off, you're not tied into it forever. There are some enrollment periods where you can make changes. You do have to stick to the rules that the plan has. And this would be also making sure you use their networks. The Medicare Advantage plans, the private companies they negotiate with doctors, with hospitals, with medical service providers, and they have them in their network, which means the Medicare Advantage plan would pay, but only if you're using a doctor or hospital who is in their network. And in and out of network makes a big difference on how much you pay with the Medicare Advantage plan. And as we said, a lot of the requirements or the companies who offer different plans vary from county to county to county. So when you're looking at a Medicare Advantage plan, if you want one in Tioga County, make sure they offer that particular plan in Tioga County. And make sure your doctors or health service providers accept that plan. That's a big question. Kathy mentioned when you go into an office, you have to make sure that they take Medicare. Yes. But if you're on a Medicare Advantage plan, you want to make sure that that doctor accepts that Medicare Advantage plan. They can say no.
Then what happens if you're going to Florida for 4 months out of the year?
Mm-hmm. With a Medicare Advantage plan, I'm assuming you're a snowbird, going to Florida if you have a plan in New York State that has a network, New York, Florida, out of network, no coverage. Now, I say that generally. There are buts and exceptions and a lot of things that may be different, but overall, if you have a Medicare Advantage plan that has a network and you go outside that network, you're not going to get coverage. Now, this would mean that any Medicare Advantage plan you have, that's one of the things you want to ask them. What if I go to Florida? Do you cover anything? It's so hard to be general about every Medicare Advantage plan. You just can't. But if you do that, if you travel, then your coverage with a Medicare Advantage plan would probably not follow you. Whereas, if you have Medicare, original Medicare, Medicare Advantage plan, if you have original Medicare and you're using the red, white, and blue card, you just, any doctor anywhere who accepts Medicare has to accept your Medicare, the red, white, and blue. And if they accept your Medicare, red, white, and blue, and you happen to have a Medigap out of New York State, they have to take that one anywhere. So out of the network with Medicare Advantage plans, probably not covered in Florida, to get back to your question there. Oh, look, you're still in Medicare when you have a Medicare Advantage plan. I don't know how many times I say that, but I still get questions. So I just want to make sure that those are the two varieties of Medicare that you have, or options if you want. There are different parts of a Medicare Advantage plan that you can get. You can see the drug coverage can be a part of that Medicare Advantage plan, all in one package. If you have a prescription drug coverage on original Medicare, that's a separate package. You can look at the chart that I have there. It lists two types of Medicare, the original on the left, and you can see that the second block, the 2, has a Part D plan with original Medicare. And I'm talking about Medicare Advantage plans on the right-hand side, and you can get a Medicare Advantage plan that does have drug coverage. So there are 2 ways to get the Medicare Part D. And whenever I say Medicare Part D, I'm talking about either the prescription drug coverage as a part of the Medicare Advantage plan or the standalone drug plan that goes with original. So it's either one of those pieces. Whenever I say Part D, it applies to either.
How does that compare to supplemental insurance, like a Medigap pricing?
Well, you know, usually with, when I explain these things, I say that the Medicare Advantage plan is very, very loosely equal to original Medicare and a Medigap and a Part D. As far as cost, just overall, generally, I'm just going to throw these numbers out at you, no cost for a premium for Medicare Advantage. You do have to pay the Part B premium, so there's $134. You may not have a premium for D. So you may pay with a Medicare Advantage plan, on one of them, $134. If you go to original Medicare, you have to pay the $134. You have to pay the $134 Part D premium. You could have a Medigap plan, $187, add to that, and a Part D that would be $40. So you're adding up, that would be, help me with the math here, to $350, could be that much. Now remember that Medigap is optional, the Part D is optional or voluntary, but if you don't get it when you're first eligible, then you may get a penalty. So, penalties. I just threw a lot of numbers at you, but that's just looking at them. And this chart is very helpful to look at the pieces of each Medicare Advantage or original Medicare. I'm leaving a lot of the reading to you, but here are some enrollment periods. So, as Kathy mentioned, everybody has an initial enrollment period. That's when you're first turning 65 or you are have been disabled, receiving Social security disability for 2 years, that is your initial enrollment period. And you can enroll in any type of Medicare around that 7-month period of your initial enrollment period. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. That's the age one. I'm just going to refer to when you turn 65 at this point. October 15th through December 7th each year is the annual enrollment period, and you can make any changes. My husband calls it the open season on Medicare for the annual enrollment period. I don't see him for a couple, 2-3 months there at the end of the year. And in this particular case, anything you enroll in starts on January 1st. Enrollment in the annual enrollment period starts January 1st. There are some special enrollment periods that you may or may not qualify for. A biggie is, what if you move right out of the state? Then you go to a different state, high cappy, typey, state state health insurance plans, and they name different things in each state. But you can also contact us anytime during the year, because we'll be glad to help you look at all the options that are available for Medicare. What is the advantage of a Medicare Advantage plan? I don't think advantage is a good word that they chose here, but you do have to have Medicare Part A and B to join. You may have Part D, as I mentioned, that can be in the package of a Medicare Advantage plan. You have to look at the networks to make sure that all your doctors and specialists will accept that particular Medicare Advantage plan that you have. Differences in Medicare Advantage plans, some may say you have to have a prior approval for a specialist. They operate differently. Each plan is set up by that particular company. So if you have a question about it, you have to go to your company to say, how do you handle it? Whereas with original Medicare, federal government will have all the rules you ever wanted.
Why would anybody go in an advantage when you can't even go out of state or go out of your network?
Well, there's 2 things with that. Some in-state, you may have no cost for a Medicare Advantage plan. So it's a good deal for them. If they go out of state, that's another issue.
Well, is that only for like people who aren't able physically maybe to leave the state? I mean, you'd be afraid to go anywhere.
You can still get covered a lot of times out of the service area, but it's going to cost you more if you're out of the network.
Going on that a little bit, with the Medicare Advantage plan, there's not just one type, of course.
Yeah.
There's not just one type of Medicare Advantage plan. You can have what is called an HMO, Health Maintenance Organization. If you have that, you're pretty well tied in or trapped in, if you want to say, the network. If you go out of the network of an HMO, then you won't get any coverage. However, there is one called a PPO, Preferred Provider Organization, and if you have a Medicare Advantage plan that is a PPO, they will give you some coverage. It'll be an out-of-network cost, which is higher than the in-network cost, but that may allow you to travel more. But you can see there's so many options to put all the things together. Do I go out of state for, 4 months for the year? What's the best time for me? So that's why a conversation with counselor, call Medicare, it's really helpful.
What about out of the United States?
What about who?
What about out of the United States?
Out of the United States, you lose.
Okay.
No, there's really no coverage by Medicare out of state except in emergency situations. If in the United States, if you went totally out of your network in a Medicare Advantage plan, you may have some coverage for an emergency situation. Original Medicare pops up and will pay that. only emergency. So let's say you're in New York, you have Medicare Advantage plan, that's one of those HMOs, it's really tight, and you go to California and you have an accident there. If it's an emergency, you will get coverage, but it's only on an emergency basis. Don't think because you have the Medicare Advantage type of Medicare that you just won't be allowed to get any services. And again, we're going to jump back into Medicare Advantage plans. There is what is called an OEP, and it's an open enrollment period for Medicare Advantage plans especially. And this means that in the beginning of each year, January through February 14th, you would be allowed to change from your Medicare Advantage plan back to original Medicare. That's the only choice at that point. You have to start with a Medicare Advantage plan, and you can go back to original Medicare. To do that, you could either enroll in another Medicare, original Medicare, by enrolling in a Part D plan. That means that when you enroll in a standalone Part D plan, your Medicare Advantage plan goes away. You can't have two. So if you have a Medicare Advantage plan between January 1st and February 14th, and you want to go back to original Medicare, just go and enroll in a separate Part D prescription drug plan. You're in original Medicare going forward after that, and your Medicare Advantage goes away. You don't have to call them to disenroll. And that's a special disenrollment period or enrollment period. Okay, drug coverage. It's available to anybody with Medicare. You can pick it up by getting it with original Medicare, a separate plan, and that's again on the chart, the left-hand side of the chart, and also it can be a part of a Medicare Advantage plan. And they are optional, but again, if you don't get it when you're first eligible, you may have a penalty down the road. With Part D plans, there are many. 15?
26.
26 Part D plans, and they vary. They vary all over the place with costs and deductibles and such. This is a standard plan. You can have a standard basic plan. I'll just tell you how it looks. And you can have enhanced plans that have to be actuarially equivalent to the standard plan, but they can do it differently. Sort of like Medicare Advantage plans and original Medicare. If you have a standard Part D, standalone Part D plan, I always call it bands of coverage. Let's say you have a Part D plan that has, in 2017, a maximum $400 deductible. So you're starting with your Part D plan, you pay your deductible. Then you are in the first band of coverage, which is, I usually call it the initial coverage amount, where you pay 25% of the cost of the drug, and the plan pays 75%. You pay that amount out of pocket up to $3,700. Once you hit that amount, you fall into the gap. And this is different from the gaps we've been talking about. The standard gap, standard drug plan gap, is also known as the donut hole. Have you heard of that? The donut hole. Anyway, once you're in the donut hole, your costs, your co-payments will change, and in differing amounts. Once you pay out of pocket in that coverage gap or donut hole up to or another $3,725, that band of coverage, you go to the catastrophic coverage, which is where you will make out like a bandit, and you won't have to pay as much as the plan pays for you. Now, again, this is a standard Part D plan. There are other types and structures. For enrolling in a Part D plan, you can have Part A or B. A and B, or A or B. You have to, again, live in the service area for the plan. You can't live outside the United States. You can't be incarcerated. And usually, you enroll in the plan on your own. There are some situations, and Arlene's going to get to those, where you may automatically be enrolled in one if your income qualifies you to be automatically enrolled. Enrolling in a Part D, very similar to enrolling in Medicare, if you want to call it that. You can do it during your initial enrollment period, the 7 months around your birthday. You can do it in the annual enrollment period if you'd like. Any enrollment there, your Part D coverage would start on January 1st. We already talked about the Medicare Advantage disenrollment period. That was from January 1st to Valentine's Day. If you wanted to change from your Medicare Advantage plan to go back to original Medicare, just enroll in the Part D plan. Take your rate out of it. And also special enrollment periods exist. There are so many of those, we couldn't even start to explain them. They're very particularized, and just moving out of your area is a common one. Lots of help available. Hi, Cap, you can call Medicare. You can do the work right on Medicare.gov. You can research any of these things, basically any of the things that we've been talking about, right on Medicare.gov. You can enroll in the plan on Medicare.gov. You can enroll in a Medicare Advantage plan. You can get information about the Medigap, but you would have to call the plan directly. How do you know if the Part D plan is right for you? Topmost, does it cover your plan? Your drugs. Does it cover your drugs? You have to see whether it does or not. Then what you want to do is then look at, do I have a deductible? How high is the premium? Then you sort of distinguish one plan from another. And you can do a lot of comparisons right on that website, Medicare.gov, if you'd like. There is an opportunity where you would not have to have Part D. You would not be penalized if you did not enroll in when you were first eligible, if you have a particular type of prescription drug coverage that is what is called creditable, which means it is as good as a Part D plan. It could possibly be with an employer, part of retiree coverage. But if you have that creditable coverage, you can delay enrolling in a Part D plan without getting a penalty when you do. And what's the timing on that? Let's say you do not have Part D because your employer offers you creditable coverage. Then you retire from that employer, you no longer get any benefits. You would have to enroll in Part D, the Medicare Part D, within 63 days of losing the employer creditable coverage in order to avoid the penalty. This is one of those special enrollment periods. So there are some time frames in there that just be aware that there are time frames on certain things in order to avoid penalties.
With your,
Mm-hmm.
I know this
No.
may be a silly question. If you don't take any drugs right now, okay, so you decide you don't want to do Part D,
Mm-hmm.
all of a sudden you get sick and you have to take 5 different new drugs next year.
Good question.
Then you find that you have to go in and get a penalty if you want to sign up for it next year, or do you have to wait until next year to sign up?
Well, there's two ways to approach the answer to that. One is, and we've had people come in and say, we don't take any drugs, why do we have to get a Part D? Once we explain that there are penalties involved if you don't get one now when you were first eligible and want one down the road, they sometimes just go in with the lowest premium cost, which is something like $18 a month. And some people just take it, and that way, if a situation comes up down the road, they do have a Part D plan, that would accommodate, hopefully, any of the prescriptions that they acquire, even though they haven't used that Part D plan before, they still have it. You may get coverage for down the road. If the second way would be if they don't have a Part D plan, didn't get one, and then all of a sudden they have prescriptions that are expensive. There are many ways to approach that. You can, yes, get a Part D plan. You have to fall into one of the enrollment periods or a special enrollment period. And there are some particular things in New York State where you would be allowed to get one anytime during the year. And that's because we have a state drug program too. So if you have that state drug program, it's like waiving a free ticket. You can enroll in a Part D plan anytime during the year. So if you find no D, then you have all these prescriptions. You can get into a Part D. It takes a little conversation or maneuvering, but you can get into one. But there are also interim coverage, if you want to call it that, discount cards, perhaps samples from your doctor. Help me out. That's about it. Yeah. But
What kind of a penalty are we talking about?
the penalty for the Part D is 1% of the national premium average for a Part D, which is about $34. So 1% of that amount per month for as long as you didn't have Part D when you could have. So let's say it was 2, 3, 4 months, you're going to get a penalty of 34 cents added on to your premium, and it'll go forever. It goes right forever. Mm-hmm.
I pay $80 to 50 cents a month, and when I went to Rite Aid, my prescription cost anywhere from $8 to $10 to $12 to $35. Not on that much medicine. So in March, I just started getting it through that place you talked about.
Epic or
The old,
discount?
yeah.
I don't know.
I thought you said the name of the place, it starts with O.
I'm blanking on that one, but there are ways that you
But
can get
anyway,
coverage.
they sent me all my medicine, 90-day supplies, where I was getting 30-day supplies at the drugstore.
It
I
sounds
got
like,
enough medicine from March until May.
I heard you saying that
I don't
earlier.
owe them a penny.
There are ways to use a Part D plan.
Because they
Where
said
you
it
can
was
get mail
money
order.
I paid into that.
You can use mail order. That's an option with a
Yeah.
Part D plan. You would discuss that with the particular plan to see how to set that up.
But one
Or you could have
prescription a day
retail.
I might get charged for, but that's all.
That's good.
And I'm probably on 7 pills.
Yeah.
Yeah.
Not paying or paying zero.
Well, they
That's
said I'd
pretty
be
good.
paying $80 a month, and then I go to Rite Aid and pay all that money, so I got credit.
Yeah.
Now that I changed, and I'm getting bottles with 90 in it instead of 30.
It varies, so you want to make sure that you talk with the pharmacy, make sure you know what you're doing, they know what they're doing, make sure that you're paying the right amount. Sounds like you're in a good situation right there. And here it is, the late enrollment penalty, at $35.63 for 2017. So that amount changes every year. So the amount of the penalty will change every year. It will be added to your premium that you choose, whatever premium for a drug plan. That amount will be paid every year, every month. So. Epic is the state prescription drug plan. As I mentioned earlier, a lot of states don't have a state prescription drug plan. We do, and it's very useful for many reasons. One would be when I talked about having a special enrollment period where you can change your plan during the year. If you enroll in Epic, don't even have to use it. Enroll in it, and you get that free ticket once a year to change a plan, anytime during the year. At Epic, you have to have a Part D plan, a federal Part D plan, in order to use Epic. You have to be 65 years or older and a New York State resident. The Epic is set up according to income. So if your income is $75,000 or less for an individual, or $100,000 or less for a couple, you qualify with all the other requirements I just mentioned.
When they figure income, is that based on taxable income? Is everything based on taxable income?
You're looking at gross income. Yeah. So, and for example, if you are applying for EPIC, you just fill out the application and send it in. EPIC goes and looks at Social Security amounts, the Internal Revenue Service for you. So when you send in your application, you don't have to send in documents to validate what you had put down there. EPIC kind of looks at all the other,
That's not a tax, you're saying gross income, so that would be money before the standard deduction, correct?
gross income.
Yeah.
Yeah, and with EPIC, looking at the income is, just the income is a good thing. You don't consider assets or anything else, it's just income with New York State specific state drug program. So it's really good. I mentioned the opportunity to change. The other benefits have to do with how much you pay. If you're, let's say you use a Part D plan, you go into the drugstore, you're all set with the deductibles, and your drug plan says, you owe us a co-payment of $50. You say, no, I have EPIC. So you give them your EPIC card, and once you have EPIC, and you're using EPIC and your Part D plan together, you only would pay, the highest you would pay is $20. With EPIC and the Part D, you pay either $3, $7, $15, or $20. Those are the only amounts that when you have EPIC, those would be the only ones that you would pay once you combine your Part D with EPIC. So not only do you get an opportunity in the year to enroll in another Part D plan, you also get an opportunity, you have the opportunity, once you've met any deductibles and such, to use Part D, EPIC, and have your cost for your deductibles lowered. Now, this worked out really well for a woman I was working with. She had, her drug costs were, one drug was $4,000. Her plan said you owe us $1,000. She had EPIC. She paid $20. So you can see that enrolling in EPIC has a lot of benefits, and it is set up only according to income. You can be set up on a fee plan or a deductible plan. Again, lots of details on how to qualify for each one, but it's looking at your income as to which you qualified for. In some cases, if your income is at a certain level, EPIC will help you pay your Part D premium. But again, looking at your income level specifically, and that's a good conversation to have with a counselor, or you can call EPIC to get more information about that. The 4099 is for 2017. That's the benchmark, if you will. So if you fall into a category for EPIC that enables EPIC to pay your Part D, your federal drug premium, EPIC would pay $40.99 towards that Part D premium. So you conceivably could have no Part D premium. Again, EPIC is, did you give them an EPIC application? We're going to do that.
In your packet, everyone has an EPIC brochure with an application attached to it.
Lots of good charts.
I guess I'm confused. Is EPIC in addition to, you have to buy a Part D plan?
Yes.
This is in addition to that Part D.
EPIC is state,
Okay.
D is federal.
Okay.
So in order to have the state, you have to have the federal first. When you go into a drugstore, federal always pays first, and then you have
Okay.
EPIC
And you
payment.
still have to come up with your deductible of $400 or whatever it is.
In most cases, maybe. It's according to your income as to what EPIC will pay. There's also another program, but you're looking at your income in particular, and certain combinations you may not have to pay that $400 deductible. But it's just, it's hard to give all the details for one person because individuals are so different. But there are benefits galore with EPIC. You can have an opportunity to change your plan and a possibility that you would have your Part D premium paid for you. You would have your deductible paid for you. So it is definitely something you want to look into and see what benefits you actually get by your enrollment there. Any questions on Epic?
Do you have to, like, if you're married, do you have to consider yourself, your incomes and stuff of both of you, or can you remain separate?
The application that you have, you can apply as an individual or as a couple. If you are married, living together, when you apply, even if it's only you applying, you have to use all the income, your spouse and your income together that goes in.
I thought you just said you could do it separate.
You would get your Epic card separately as an individual, and if you have a spouse, they would get their Epic information card separate. But when you apply for it, in that particular household, married, living together, you have to give everybody's income to set you off on your Epic.
Is that your income after deduction, like on your income tax? Gross. Yeah.
Good, very good. When you have prescription drugs, your Part D plan, if your Part D plan pays for that drug, usually Epic will pay. And of course, I say usually because there are some times where perhaps Epic doesn't have a negotiated agreement with a certain pharmacy or plan. But that's few and far between. Usually when the Part D plan pays, and it has to pay first, then Epic will come in and pay.
That used to be separate before it joined us. It was sold separate.
Yeah, it's
The
changed.
parents belong to us.
It's changed over the years. Yeah, you do have to have the Part D now in order to
If you
have
have
that.
Medicare Advantage and you have prescription drugs under that, can you still get Epic?
Yes. If you have, the question is, if you have a Medicare Advantage plan with drug coverage, can you still have Epic? Yes. It would still apply to that drug piece that's a part of the Medicare Advantage plan. Great question. Great question. Okay, so this is what you have to remember from all we said today is just Medicare is a federal government health insurance program. It doesn't cover everything. You have choices, lots of choices. Original, Medigap, Medicare Advantage, Epic. Arlene's going to give you some more. And if you have other insurances, any other insurance, retiree coverage, VA, workers' compensation, active employment coverage, once you turn 65 or become eligible for Medicare for the first time and you have other things, you do have to see how they combine. You know, with, just for example, VA benefits, separate from Medicare. You can have both, but you just can't use them together. That's a broad stroke description of what VA benefits do. But it is so important when you become Medicare eligible, not only to see what Medicare pieces are available, but what other insurances do you have, and how does that actually, how do they combine? Lots of the decisions are time sensitive, avoid those penalties. Help is available. If you have certain incomes, there are certain programs that can assist in paying for various deductibles, co-payments, that type of thing. And I think Arlene is going to take care of that. Are we there? Epic?
Are you all set?
Here's you.
Oh, okay.
You're on.
Are there any further questions for Jane?
Everyone's done a great job.
Thank you. Yeah, they have, haven't they? Thank you. Before I get started, I just wanted to point out, Pat Davis, could you raise your hand? She's also a high-tech volunteer, so I just wanted to let you know about her.
She'll be up here next time.
Yes, they will. So, this is my part. In your packet, there are two bottom pages that I want you to pull out. The first one says, are you having difficulty with the cost of your Medicare health care and prescription drug costs? Does everyone have that? Okay. So, actually, Kathy created this page. It's going to kind of simplify a little bit what I'm going to go over here.
Do
But there,
do you want it, is it on there?
no,
Okay.
it's not. It's in their packet.
Yeah.
Okay, so there is help for people with limited income and resources within Medicare. There are Medicare savings programs, also known as MSP, and that is help from Medicaid that helps pay for your Medicare costs. You could be income eligible above Medicaid to be eligible for some of these Medicare savings programs. And there's four, and I'm not going to go into all the details of those. And having the Medicare savings program gives you an automatic enrollment into a program called Extra Help, which is from a program that Social Security helps you get extra help with your prescription costs. So, Extra Help, also known as LIS, Low Income Subsidy, helps pay for your Part B prescription drug costs, that benchmark amount that Sarah Jane mentioned of $40.99. Having Extra Help may help pay that Part B premium for you. And then it also helps lower the copays that your prescription drug plan, you know, you have the copay, you're paying the premium for the drug plan, and then you have certain copays, and then the Extra Help program can lower those copays depending on if you're receive the full Extra Help benefit or a partial Extra Help benefit. So what this page does is it simplifies you just knowing the amount of your income. If you just look at that first bullet, if your monthly income is under those two amounts, there's an amount for if you're single or married. On both bullets, the first bullet is the amount for if you could get help with prescription drug costs. And the second one is for additional health care benefits, which would be the Medicare savings program.
And these are for gross income, yes.
Yes, your gross income before the Part B is deducted of your Medicare. So basically, I want you to refer to this. If this is for you, or if you know somebody, we all know people this might apply to, and you can spread the word. This is the main part of my job. I want to screen everyone who is receiving Medicare to see if there's extra help with their costs. And I don't mean it as like Social Security's extra help, but, you know, there's help available. And that's the main part of my job, is to screen and help with the application processes for these programs. And then on the bottom, there's my name, bold, and font that I can read, with my phone number. Please don't hesitate to call me. I can do a screening over the phone with you, or you can come in one-on-one, and we can go over this, and I can help you apply for these programs. I did 2 MSP applications this morning to help a family get the cost of their Part B training back into their Social Security. They're so grateful for that. It's very helpful. And are there any questions about that? Okay, and then the last page in your packet, it says the Medicare 101 Seminar Evaluation. If you could fill that out. Now, I want to point out, down about to the middle of the page, it says, do you know about Medicare changes for 2016? What we mean is 2017 now. I realized after I printed these out that the year was wrong, but I didn't want to waste paper. I'm a big recycler, so it is for 2017. So you can fill those out and leave them right there on your table. And does anyone have any further questions?
I don't have a question, but I'm new to the high
Yes.
cap group, and I'll be for Medicare in January. I think it would be interesting if people heard, if you have this information, how many people in a year that you actually help? Do you have we do,
For a count with everyone,
that you help through your phone calls, through your meetings?
it is tracked, and it's in my monthly report, but we range from I take probably 80 to 150 phone calls a month, and I counsel between, I want to say an average is about maybe 80 to 100 people per month that I counsel, and the other counselors counsel. Of course, during our annual election period, it's just crazy. The numbers go, skyrocket. But we help a lot of people. We help a lot of people.
Thank you.
And as a group, we probably do help with the Medicare Savings Program about an average of 6 to 8 applications per month, helping people get help with their Medicare costs. Thank you all for coming.
Thank you.
Bye. You did a great job.